So, picture this. You're at a totally routine eye exam, maybe picking out new frames, and you walk out with a diagnosis that just sounds heavy. Today, we're going to take that confusing feeling and turn it into a clear, calm, practical guide. I promise, by the end of this, you'll have a plan, not panic.
Right? It's one of those phrases that just stops you in your tracks. You went in for a simple checkup, and you left with that. It's jarring, it's confusing, and it feels like the whole day just kind of shattered on the floor.
And that is the most baffling part of it all, isn't it? There's no pain, your vision seems fine, it's just a note on a piece of paper. You feel completely normal, but your doctor saw something. So what in the world does that mean, and what are you supposed to do now?
Okay, let's start by just stripping away all the medical jargon. What does hypertensive retinopathy actually mean in plain English?
It's actually a lot simpler than it sounds. Hypertensive, that just means it's related to high blood pressure. And retinopathy? That means something's up with the retina, which is the light-sensitive tissue at the very back of your eye. So all it means is that your doctor saw visible evidence of stress on your tiny blood vessels, and that stress is coming from high blood pressure.
And this is what makes your eye so incredible. A doctor can't just, peek inside your brain or your kidneys to check out the tiny little arteries in there, but they can look directly at the ones in your retina. It's the only place in your entire body where this is possible, which makes your eye a literal window into the health of your entire system.
I want you to really let this sink in because it's such a powerful way to think about it. This is not a crystal ball predicting some terrible future. It's a receipt. It's a paper trail that shows the effects of pressure that's been quietly building up over time. It's simply proof that something has been happening, even if you couldn't feel it.
Okay, so let's get to the most critical question. When is this an actual drop-everything emergency? Before we decode any more of those terms, we have to talk about safety first.
This is the number to burn into your memory, 180 over 120. Health organizations often point to this as the threshold for what's called a hypertensive crisis. If you check your blood pressure and it's at or above this level, especially if you're also having symptoms, it is absolutely time to seek urgent care.
And if you experience any of these things, that is a major red flag. We're talking sudden vision changes, any neurologic signs like your face drooping or the worst headache of your life, or any kind of chest pressure and severe shortness of breath. These are not wait-and-see symptoms. These mean go to the emergency room now.
So let's just break it down into a simple checklist. Do you have any of those red flag symptoms or a crisis-level blood pressure with symptoms? That's a definite yes. Act today. Did your doctor happen to mention the words optic disc swelling? That's also an immediate yes. But if the findings were mild and you feel fine, it's not a 911 emergency, but it absolutely means you need to take action this week.
Okay, now that we've covered the urgent safety stuff, let's become translators. We're going to decode those specific, weird-sounding terms that your eye doctor might have actually used in your exam notes.
So, first up, you might have heard arteriolar narrowing. The best way to think about this is like a long-term stress posture. Over a long time, high pressure makes those tiny arteries in your retina start to stiffen up and get a little smaller. It's a sign of chronic sustained pressure, like a footprint it's left behind. Then there's something called AV nicking. This is another sign that things have been going on for a while. You see, where a stiffened artery crosses over a softer, more flexible vein, it can actually press down and create a little indent, or a nick. This tells the doctor that the high pressure has been around long enough to change the very structure of the blood vessel walls.
Now this is a fantastic way to picture it. Cotton wool spots look like little fluffy white patches, and they show up when a tiny area of the retina has had its blood supply temporarily cut off. It's basically like a brief power outage for the nerve fibers in that spot, and it signals that blood flow has been compromised.
And finally, you might hear about hemorrhages and hard exudates. These findings mean things have started to get leaky. Hemorrhages are just tiny little bleeds, a sign that there's a break in the vessel wall. And hard exudates? They're the fatty stuff and proteins that leak out and get left behind, kind of like a stain. Both are signs of active injury to the vessel.
Now pay close attention here. If you hear the term optic disc swelling or maybe papilledema, that changes everything. This is a very serious finding. It's often linked to dangerously high blood pressure, and it immediately bumps up the urgency from act this week to act today. This one is a big deal.
All right, let's pull the camera back for a second. Let's zoom out, because this isn't just about your eyes. The things your doctor saw in your retina are telling a much, much bigger story about your overall health.
And we come right back to that central, confusing question.
It's because your retina is incredibly resilient, and honestly, your brain is amazing at compensating for small problems. A lot of these changes can happen quietly in the background, long before they ever start to affect your actual vision. The eye exam is designed to catch them early.
Think about this story for a second. A friend gets a gentle warning about some hypertensive changes. He kind of laughs it off, feels fine, and promises himself he'll deal with it after a big work deadline. Well, days later, he's in urgent care. And he said the scariest part wasn't the symptoms themselves. It was the chilling realization that his body had been sending him these quiet signals, and he had just trained himself not to listen.
And that story just perfectly illustrates the real takeaway here. The changes in your retina, they're a stand-in, a visible marker for what might be happening to tiny blood vessels everywhere, in your heart, in your brain, in your kidneys. All of a sudden, the vague idea of prevention isn't some abstract concept for later. It's real, and it's right now.
Okay, enough information. It's time to get empowered. Let's pivot from just understanding the problem to building your concrete, actionable plan, starting this very minute. This is your first and most important task. You're going to create a blood pressure log that a doctor can actually use. For 7 straight days, measure it in the morning and in the evening. Each time, take 2 readings a minute apart to make sure they're accurate. And make sure you're rested and calm. Write it all down. This data, this pattern, is 1,000 times more valuable than one random reading at the pharmacy.
And you don't even have to worry about what to say. We've written the message for you. Seriously, just copy this, attach the note from your eye exam and that awesome 7-day log you just made, and send it to your primary care doctor's office. It's clear, it's concise, and it gives them everything they need to help you.
So let's put it all together one last time. Level 1, ER now for any of those red flag symptoms. Level 2, same-day action if your doctor mentions severe findings, like optic disc swelling. Level 3, act this week for any mild or moderate findings. And Level 4, that's where you maintain control once you and your doctor have a plan. Look, this diagnosis isn't a dead end. It's a crossroads. It's a very clear signal to take action. Your body sent a warning. So the question is, what's your plan going to be?